Today's Lindsay Clancy Trial raised a question every mental health provider should pay attention to. What happens when multiple providers are prescribing psychiatric medications but may not have the full picture? Today's testimony in the Lindsay Clancy Trial highlighted something we see in mental health care: the importance of communication and coordination between providers. The jury heard testimony about Lindsay's psychiatric treatments, including medication management by different clinicians during a period when she was struggling with significant anxiety, racing thoughts, intrusive thoughts, insomnia, and feeling detached. One important issue raised during the testimony was whether each provider had a complete understanding of the medications Lindsay was taking and the changes being made by other clinicians. As a psychiatric provider, this is important. When multiple providers are involved in a patient care, especially when medications are being started, stopped, tapered, discontinued, or adjusted, communication matters. We need to know what is the working diagnosis, what medications have been tried, why were they discontinued, what symptoms are getting worse, and are there any new warning signs that require us to reassess the diagnosis or level of care? But we also have to be careful not to walk backward from this tragedy and assume that medication changes or communications between the providers caused what happened. The central question still remains: what was Lindsay Clancy's mental state when she killed her 3 children? And that is ultimately something the jury will have to determine after hearing all the evidence.